Well, main problem with diagnosis is to find out whether people are taking their antihypertensive drugs. And it's a huge problem with adherence. And we are moving forward because now we have the possibility of measuring the antihypertensive drugs in urine and in blood. And there are other methods like prescription registries. We are actually using direct observed treatment, then followed by ambulatory blood pressure measurements. So there are that kind of things you can do for the diagnosis. Main challenges is we simply don't know how many people have refractory or resistant hypertension because of these uncertainties whether they take the drugs or not. So challenges is really point one, to have people to take the drugs, and then to have the doctors, the physicians to up-titrate the patients to reach the blood pressure targets and make sure and convince the patients that they should take their drugs. And then you probably remain with just 1 or 2% of the hypertensive patients remaining uncontrolled. Well, it's an extremely complicated question. I mean, this has been known for like 30, 40 years. I mean, it was very detailed in the Joint National Committee in the US. You really need to convince people it's necessary to take the drugs. You need to go through it in detail, tell them about the side effects, tell them about the importance of taking it, telling them about the complications if they are not treated and taking the drugs. And you need to control their blood and urine for taking the drugs and so on. There's a huge number of measurements you can do. First we need to find out how many people really have resistant hypertension. Okay, there are new devices, renal denervation, we don't know whether it's lowering blood pressure or not, has not been decided yet. We have a bioreceptor activator in therapy, BAT, which is somewhat more promising, but still need more documentation from clinical trials. And we need to find out the psychology about this. We need to investigate the hemodynamics of resistant hypertension. We can adjust the drug treatment for the high total peripheral resistance, for high bulimia, and give them more diuretic treatment, and we can control the high blood pressure. And we can find out why doctors do not up-titrate patients to the treatment target. So there's a host of different things that need to be investigated further.